During sleep, your body is supposed to become more stable, not more fragile. Your heart slows down, your blood pressure drops, and your nervous system shifts into a quieter, recovery mode. But in certain situations, that same transition can become unstable, and when it does, the risk of a serious event can rise without warning. I'm Dr. Warren Hung. On this channel, I focus on helping you understand how your body actually works so you can protect your health long before something serious happens. If you find this kind of explanation helpful, consider subscribing so you can continue learning in a clear, practical way. When people hear that someone died in their sleep, it often sounds peaceful, almost random. But medically, it is rarely random. In many cases, there is a chain of events building underneath something affecting the heart, the blood vessels, or the brain that becomes most dangerous during the night. The reason this matters is because sleep is not a passive state. Your body is actively regulating oxygen levels, blood flow, heart rhythm, and pressure. Small disturbances in any of these systems can become more significant when the body is in this vulnerable transition. For example, your blood pressure normally dips during sleep. This is called nocturnal dipping, and it gives your cardiovascular system a chance to rest. But in some people, especially those with hypertension or metabolic conditions, that pattern is disrupted. Instead of dipping, the pressure may stay elevated or even spike at certain points in the night. According to data from ambulatory blood pressure monitoring studies referenced in European Society of Cardiology guidance, abnormal nighttime blood pressure patterns are strongly associated with higher risk of stroke and heart events. At the same time, your breathing pattern changes. Oxygen levels can fluctuate more than during the day, particularly if the airway becomes partially blocked. Even brief drops in oxygen can trigger stress responses in the body, releasing hormones, increasing heart rate, and tightening blood vessels. There is also a change in how your blood behaves. During the night, especially in the early morning hours, the blood can become slightly more prone to clotting. This is one reason why heart attacks and strokes are more likely to occur in the early morning window, a pattern observed in multiple cardiovascular cohort studies, including analyses referenced by the American Heart Association. Individually, each of these changes is manageable in a healthy system. But when they overlap slightly higher pressure, reduced oxygen, increased clotting tendency, the system can become unstable. What makes this difficult is that many of the contributing factors come from behaviors or conditions that feel completely ordinary, things people do every evening without thinking, habits that don't feel dangerous because the effect is not immediate. And over time, especially with aging or conditions like diabetes, high blood pressure, or high cholesterol, the body has less reserve. It becomes less able to compensate for these stresses. What would have been tolerated years ago can become risky without obvious warning signs. This is where the misunderstanding happens. The event seems sudden, but the process is not. It builds quietly, often for years, and sleep becomes the moment where the system is most exposed. But to understand why certain nighttime habits can trigger these events, you first need to see what the body is actually doing during sleep and where that process starts to break down. When you fall asleep, your body does not simply shut off. It shifts into a different mode of control. During the first part of the night, the nervous system reduces its daytime activity. Heart rate slows, blood pressure drops, breathing becomes more regular. This is controlled by the parasympathetic system, which you can think of as the body's recovery setting. At the same time, your blood vessels relax slightly, allowing blood to flow with less resistance. This is one reason sleep is so important for cardiovascular health. It gives the system a chance to reset after the stress of the day. But this balance depends on stability. Your brain is constantly monitoring oxygen levels, carbon dioxide levels, and blood pressure. If something shifts too far, oxygen drops, pressure rises, or the heart rhythm becomes irregular, the body reacts quickly. It releases stress hormones like adrenaline, increases heart rate, and tightens blood vessels to compensate. These corrections are meant to protect you, but repeated disturbances can create strain. One of the most important factors here is oxygen. During normal sleep, oxygen levels remain stable. But if the airway narrows or becomes blocked even briefly, oxygen can drop. The body responds immediately by activating stress pathways. Heart rate rises, blood pressure increases. The blood vessels constrict. If this happens occasionally, the body recovers. But if it happens repeatedly throughout the night, it creates a pattern of stress during a time that should be restorative. This is commonly seen in conditions like obstructive sleep apnea, where breathing repeatedly stops and starts. According to the American Heart Association, untreated sleep apnea is associated with higher risks of hypertension, arrhythmias, stroke, and heart attack. But even without a formal diagnosis, milder forms of airway resistance or poor sleep positioning can still create smaller, repeated oxygen fluctuations that many people never notice. Another key factor is blood pressure behavior during sleep. As mentioned earlier, blood pressure is supposed to dip at night. This reduction lowers strain on the arteries, but in some individuals, the pressure does not fall as expected. In others, it fluctuates unpredictably. Data from ambulatory monitoring studies used in European Society of Cardiology recommendations show that people with non-dipping or reverse dipping patterns, where pressure stays high or rises at night, have a significantly increased risk of stroke compared to those with normal patterns. Now add one more layer: blood clotting tendency. In the early morning hours, the body naturally shifts toward a slightly more pro-clotting state. This is part of the circadian rhythm, the internal timing system that regulates many biological processes. Platelets become more active, and certain clotting factors increase. This is one reason why cardiovascular events often cluster in the early morning. Individually, these changes are normal. But when they combine oxygen drops, pressure instability, increased clotting, the system becomes more vulnerable. I remember a patient in his early 70s who told me he felt completely fine during the day. His blood pressure readings at the clinic were acceptable, but he often woke up feeling tired, with a mild headache that he assumed was just poor sleep. When we looked closer, his overnight pattern told a different story. His blood pressure was not dipping properly, and there were signs of repeated oxygen disturbance during sleep. What this shows is how easy it is to miss what's happening at night. Daytime measurements can look normal while the real stress is occurring during sleep. And this illustrates something important about how the body works. The night is not just rest. It is a period of active regulation. And when that regulation is repeatedly disrupted, even in subtle ways, the cumulative effect can increase the risk of serious events. The difficulty is that most of these disruptions are tied to behaviors or conditions that feel routine. They don't feel like warning signs. And this is where it becomes critical to identify the specific habits and triggers that quietly push the system in the wrong direction while you sleep. By now, you can see that the risk during sleep is not random. It comes from specific stresses on the heart, blood vessels, and oxygen system that build up quietly. What makes this dangerous is that many of these triggers come from habits that feel completely normal. In this section, I'm going to name them clearly. 1. Going to bed with poorly controlled blood pressure. Many people assume that if their blood pressure looks acceptable during the day, they are protected at night. That is not always true. Blood pressure follows a rhythm. It should drop during sleep, but in people with hypertension, diabetes, or vascular stiffness, that drop often does not happen properly. Instead, pressure may stay elevated or rise unpredictably during the night. Why does this matter? Because high nighttime pressure puts direct stress on the arteries that supply the brain and heart. It increases the chance of plaque rupture and makes the blood vessels more vulnerable to damage. According to European Society of Cardiology guidance based on ambulatory monitoring studies, abnormal nighttime blood pressure patterns are strongly linked to stroke risk, even more than daytime readings in some cases. Who is most at risk? People over 60. Those with hypertension or prehypertension, people with diabetes or kidney disease. What to change? Take prescribed blood pressure medication consistently. Ask your doctor if timing of medication should be adjusted. Consider home or ambulatory monitoring if readings are inconsistent. 2. Sleeping with repeated oxygen drops, often unnoticed. This is one of the most underestimated risks. If your airway narrows during sleep, even partially, your oxygen level can drop. You may not wake up fully, but your body reacts. Each drop triggers a stress response. Heart rate increases. Blood pressure rises. Blood vessels tighten. Over time, this repeated cycle places strain on the cardiovascular system. This is most clearly seen in obstructive sleep apnea, but milder forms can still have effects. The American Heart Association has identified untreated sleep apnea as a significant contributor to hypertension, arrhythmias, stroke, and heart disease. Who is most at risk? People who snore regularly. Those who wake up tired despite sleeping. Individuals who are overweight or have a thicker neck circumference. Older adults with reduced airway tone. What to change? Pay attention to snoring, gasping, or unexplained fatigue. Ask about a sleep study if symptoms are present. Avoid alcohol close to bedtime, as it relaxes airway muscles. 3. Late-night heavy meals and metabolic stress. Eating late, especially heavy or high-fat meals, is often seen as a comfort habit. But metabolically, it changes how your body behaves during sleep. After a large meal, blood sugar rises. Insulin is released. Digestion increases blood flow demand. Inflammation markers can rise. Instead of entering a stable recovery state, your body remains metabolically active. This can interfere with normal blood pressure dipping and may increase nighttime heart strain, particularly in people with insulin resistance or diabetes. Large observational data sets, including analyses from NHANES and metabolic studies, suggest that late-night eating patterns are associated with poorer cardiovascular and metabolic outcomes, though causation is still being studied. Who is most at risk? People with diabetes or prediabetes, those with high triglycerides, individuals with reflux or poor sleep quality. What to change? Aim to finish your last meal at least 2-3 hours before sleep. Keep evening meals lighter and easier to digest. Avoid large spikes in sugar or processed carbohydrates late at night. 4. Ignoring subtle warning signs before bed. This is often the most overlooked trigger. People tend to dismiss mild symptoms at night. Slight chest discomfort, unusual fatigue, mild shortness of breath, a sense of pressure or heaviness. Because the symptoms are not severe, they are often ignored. But from a clinical perspective, these can be early warning signs of cardiovascular strain. During sleep, when blood pressure, heart rhythm, and oxygen balance are shifting, an already stressed system has less reserve. That means a small problem can become a larger one. According to American Heart Association guidance, many heart attacks are preceded by subtle symptoms hours before the event, especially in older adults. Who is most at risk? Individuals with known heart disease. People with multiple risk factors, hypertension, diabetes, high cholesterol. Older adults. What to change? Do not dismiss new or unusual symptoms. If something feels different from your baseline, take it seriously. Seek medical evaluation when patterns repeat or worsen. When you look at these 4 triggers together, a pattern becomes clear. None of them feel extreme. They are quiet, familiar, easy to overlook. But physiologically, they all push the body in the same direction. Higher pressure, lower oxygen stability, increased stress signals, reduced recovery. And during sleep, when your body is more sensitive to imbalance, that combination can matter more than people realize. And once you understand these triggers, the next step is to turn that knowledge into something practical, something you can actually use tonight to reduce that risk. Once you understand what increases risk during sleep, the goal is not to become anxious about it. The goal is to bring the system back into stability. What matters most is not doing everything perfectly. It is removing the biggest sources of strain and giving your body a more predictable environment overnight. A simple way to approach this is to think in terms of a short nightly framework. Step 1. Stabilize your evenings. The hours before sleep shape what happens during sleep. Try to create a consistent pattern. Finish your last meal 2-3 hours before bed. Avoid heavy, high-fat, or high-sugar meals late at night. Limit alcohol, especially close to bedtime. These changes reduce metabolic activity and help your body shift more cleanly into its recovery mode. If you often feel overly full, bloated, or restless at night, that is a signal your system is not transitioning smoothly. Step 2. Support stable breathing and oxygen. Breathing stability is one of the most important protections for the heart during sleep. Pay attention to signs such as loud or frequent snoring, waking up tired despite enough hours in bed, morning headaches. These are not just sleep quality issues, they can reflect repeated oxygen disturbance. If these patterns sound familiar, it is reasonable to ask your doctor about evaluation for sleep-related breathing issues. A sleep study can provide clear answers. Even small adjustments like sleep position or reducing alcohol can improve airway stability. Step 3. Bring nighttime blood pressure into control. Blood pressure is not just a daytime number. If you have hypertension, the question is not only what is my reading in the clinic, but also what is happening at night. For some people, medication timing matters. In certain cases, shifting part of the treatment to the evening helps restore a more normal nighttime pattern. This approach is supported by research on circadian blood pressure control, though it should always be guided by a physician. If your readings vary or if you have multiple risk factors, discussing home or 24-hour monitoring can provide a more complete picture. Step 4. Respect subtle signals. Your body often gives early warnings. If you notice, new chest discomfort, unusual shortness of breath, fatigue that feels different from your usual baseline, a sense that something is not quite right. Do not ignore it simply because it is nighttime or because it seems mild. From a clinical standpoint, these small signals can matter more than people expect, especially in individuals with underlying risk factors. Acting earlier is often what prevents more serious events. Step 5. Know your risk profile. This step is often overlooked. The same habit does not carry the same risk for everyone. If you are over 60, living with diabetes, managing high blood pressure, dealing with high cholesterol, or have known cardiovascular disease, your margin for error is smaller. That does not mean something bad will happen. It means your system has less reserve, so stability becomes more important. Understanding this helps you take the right things seriously, without overreacting to everything. When you put these steps together, what you get is not a strict routine, but a pattern. Reduce late-night strain. Support stable breathing. Keep blood pressure controlled overnight. Pay attention to early signals. Adjust based on your personal risk. That combination shifts the body back toward a more stable state during sleep. If you find these explanations helpful and want more clear, practical guidance like this, consider subscribing so you can continue learning in a way that supports your long-term health. One simple way to start is this. Tonight, notice what your last 2 hours before bed actually look like. That window often determines how stable your system will be overnight. And if any part of this sounded familiar, whether it is snoring, late meals, or subtle symptoms, it may be worth paying closer attention this week. If you're comfortable, let me know in the comments which of these patterns you recognize or what you would like explained next. The goal is not to fear sleep. It is to understand what your body needs so that sleep can do what it is meant to do, protect you, not expose you.